Hi, this is Dr. Daniel Woodruff, and I'd like to welcome our members to my latissimus dorsi tip secret hint video. You see, sometimes when we do the standard protocol for the shoulders, it doesn't quite release it. So this is a little trick I've had up my sleeve and I've used for years. And what it does is it helps to release the latissimus dorsi muscle. Let me show you what I mean. The latissimus dorsi muscle, the main body of it is going to be here in the low back. In fact, it's the largest muscle in the human body. Now, there is, from the body, it goes up and inserts to the bottom of the shoulder blade, and it comes up and goes past the arm and hooks onto the inside. What this does is it allows the arm to go back and then across the body. So if we're not getting a good release on that shoulder by using our standard protocol, the next thing we check out is the latissimus dorsi. So what we're going to do is we're going to push down until we feel that muscle. And how you're going to be able to tell muscle from skin tissue, fat tissue, is that once you hit it, you get resistance. So right there is the beginning part of that muscle belly. Now I'm going to leave the vibration in here for about 10 seconds. And I'll also do a little bit of slow rotation, just to kind of stretch that muscle a little bit as I do it. Then from there, I have the patient put their arm up and over their head, just like so. Now what this does is it gives me a clean shot on that latissimus dorsi. And it's like a ridge, okay? And you're going to ride that ridge all the way up. Now you got to be careful. We have ribs here, so you want to be firm. You just don't want to place it on top. You want to give a little pressure, but not too much. Those ribs are very tender. And so you're going to place it right where that ridge begins, and you're going to do the slow count. Usually I work a 5 on my slow count, and we just work it up along that ridge. And we keep going until we get right up here at the beginning of the tricep. Now I will do about 4 or 5 passages. If we test it and I still don't get that release on the shoulder, I'll do the process again. Sometimes it takes twice. This is a very large muscle. So a lot of times we need to do a lot of vibration to stimulate those proprioceptive nerves. This is a technique that I use especially when the patient will tell me that they have low back pain along with shoulder stiffness.